Horizon Health Network provides healthcare services to approximately 2/3 of the population of New Brunswick. Recognizing that childhood trauma increases risk for addiction, mental illness, and other chronic diseases, Horizon saw the CCSA's Brain Builders Lab as an opportunity to help catalyze a cross-departmental approach to prevention and intervention for adverse childhood experiences. Our team was comprised of care providers in community-based primary health care services from our addiction and mental health, primary health care, public health, and population health departments.
5 of us who had the good fortune to be involved with some education in March of 2019 called Brain Builders Lab. Incredible 2 days of learning, all about brain and brain story. Really cemented and validated all of the work that I've done for the past 30 years here in public health. We actually shared brain story concepts in a staff meeting, and I used the brain architecture game. People built brains, they looked at trauma, they looked at what happened to children in their past and what types of brains they built, what made them stronger and what made them weaker.
We worked to gain leadership buy-in for using the Brain Story certification course as a tool for staff training.
I really enjoyed doing the Brain Story certification, and the thing that I liked the most, I think, is talking about improving services to children with mental health challenges by helping the parents. So the 2-generation approach really resonated with me, and how it's changed my practice is focusing on the parents instead of as an afterthought, checking on their mental health, giving them support with their own strategies as well as ones to help their children. And I'm seeing a lot of success with it.
We work to build history taking around adverse childhood experiences, or ACEs, into our clinical practices with remarkable results.
We see a lot of patients with chronic illness, with mental health issues, with addictions. A lot of our patients expressed that they had gone through some traumatic experiences, and we saw it as a common theme. Also common was that they had never spoke to anybody about it. An adult female that I'd been seeing for some time who was really having difficulties moving forward with her management in chronic disease and mental illness, and really feeling guilty and blaming herself. After we did the ACE score and she scored 7 out of 10, I discussed trauma with her and how it affects brain development at an early age and how it can increase people's risk for mental illness, for suicide, for chronic diseases. It was probably the first time that I could see a weight lift off of this patient's shoulders, and we were able to move forward with her treatment successfully. So that's been probably one of the most important visits that I've had in my career.
Here are some of our impacts.